Okay, so let's talk still about nursing informatics leadership. And focus of this discussion is the functional areas of nursing informatics. Now, if you would look at these slides, I don't want you to memorize this slide, but instead just familiarize what are the different functional areas of nursing informatics. And when I talk about these functional areas of nursing informatics, just think of them as if they are the scope also of nursing informatics. Now, try to look at this example. If you would see this one, that would mean that informatics is used in administration, leadership, and management. Informatics is also used in education and professional development. We also have informatics for genetics and genomics. We also have informatics in research and evaluation. So kindly familiarize yourselves with these different functional areas in nursing informatics. Now let's talk about administration, leadership, and management. When we say administration, leadership, and management positions, that would mean that we are using nursing informatics as senior leaders. For example, you have your CNIO, your Chief Nursing Informatics Officer, or your CIO, which is the Chief Informatics Officer. So if you are in these senior leadership positions, your role are to be visionary and establish direction for large-scale informatics solution. And you need to be the catalyst for developing strategic plans and creating national system policies and procedures. So ano pong ibig sabihin natin dito? So tayo pong mga nurses, we are using informatics as an administrator, as a manager, as a leader. And if we are using informatics for that purpose, we use informatics to guide our vision. We also use informatics to guide our direction for large-scale use and to be catalyst for developing strategic plans. Plus, pag sinabi kong strategic plans, just think of it as long-term plans. At saka pag sinabi nating nursing informatics, it will be able to guide us in these long-term decisions that we will be making. Now, next is your mid-level management. For your mid-level management, ano ginagawa natin? Yung mid-level po yung nagsusupervise ng resources at saka ng activities. Yung mid-level din po yung nag-analyze ng requirements, gather data, design development, sila nagse-select, purchase, test, implement, and evaluate the system to support all facets of nursing and healthcare delivery. Now, class, what we are trying to do here is differentiate the senior level at saka yung mid-level. Ito lang yung tandaan nyo. Pag sinabi kong senior level management class, they would usually deal with the top positions. Okay? They would usually deal with the highest positions. Sila po yung tinatawag nating isulat, policy making body. Okay, they are being referred to as your policy-making body. But when I talk about your mid-level management is the one that implements these policies that are made by the top-level management. Okay? Yung implementing body po is yung mid-level management. Again, the senior management or the top management is considered to be your policy-making body, whereas the implementing body is your mid-level management. Okay? Now, if you would look at the next slide, so this talks about the role of the nurse informaticist. So class, bilang nurse executive, meron tayong responsibility to evaluate, select, and deploy advanced technologies. And for us to do it, there are two requirements that we need to know. No? So again, sabi dito, bilang nurse executive, dapat marunong tayong mag-evaluate, mag-select, at saka mag-deploy ng advanced technologies. And para magawa natin yan, dapat, one, we should have a deep personal and nursing-centric knowledge of the technology. Okay? And two, we need to have access to the knowledge which is resident in technology expertise. Okay? So kung hindi man tayo yung expert sa technology, dapat meron tayong access sa mga individuals na expert in the technology. So what do we mean by that? No? Bumabalik po ito. This goes back to our early topics and discussion that when we talk about technology, technology is actually part of caring in nursing. Okay? And we need to have that knowledge in technology. But if ever that we don't have the expertise in technology, we need to have access of somebody who is a technological expert. Okay? That way, we will be able to evaluate. That way, we will be able to select and deploy advanced technologies. Mahirap po kasi na mag-implement tayo ng mga technological changes in our organization wherein we do not have the knowledge on the use of technology. That's why it is made clear to us that you need to have the knowledge or you need to have access to the expert. And there are 3 distinct disciplines needed by an effective informaticist. And what are these 3 effective class na disciplines? 1 is clinical nursing. 2 class is information technology. And then 3 class it's research. Okay? Ano pong ibig sabihin? Bakit nandyan po yung 3 yan sa listahan? Class, for us to become an effective informaticist, we need to have background in these 3 areas. Hindi po pwede na clinical nursing lang. Dapat may background ka rin sa information technology and dapat may background ka rin sa research for you to become an effective informaticist. Okay? Now, sir, bakit kailangan pa yung background sa information technology? Because it is your background on information technology that will give us the idea if what is the appropriate technology to be used. Okay? But your background in clinical nursing is the one that will give you the idea on how to care for the patient. That's why sinasabi ng iba, sir, IT na lang yung bahala. Plus IT is an expert on their field. But they do not care for the patients. No? Hindi po sila yung nag-aalaga sa mga pasyente natin. Wala po silang idea kung ano pong kakailanganin ng pasyente natin. And to ensure that our patient would receive effective care using the technology, dapat may nurse informaticist talaga. Okay? Now, what are the 2 specific types of IT expertise that we also need to know? One is your process mapping, and then the next one is your workflow design. When I talk about process mapping, your process mapping class is done. Okay? Class, tingnan nyo lang yung name. Yung pangalan po is process mapping. In other words, class, minamap niya yung proseso. Okay? It is the mapping of the process. In other words, if there are processes done in the hospital, it is being placed in a diagram wherein it could be easily understood by the individuals. As the definition would say, it would delineate the actual steps of clinical practice as they occur during patient care. Okay, it is talking about the actual steps as they occur during patient care. That's your process mapping. Whereas class, when I talk about workflow design, the workflow design class would span the arrangement of information, forms, and triggers to document nursing practice. Okay? Class, the important words there is that it would span information, forms, and triggers to document nursing practice. Now, let's try to differentiate. No? Plus, tignan nyo itong process map. Okay? Try to look at the process map example here that I am sharing to you. You can see that the patient would check, the nurse would check the medication form in the chart, the physician would write the order, then the attendant will go to the pharmacy with the form, the pharmacy will open, the prescription available is written, the attendant brings written prescription to the bedside. So class, kung titingnan nyo, parang ano siya, parang step by step on how to get the medications from the pharmacy. Okay? How to get the medications from the pharmacy papunta sa pagbigay ni patient ng meds, papunta sa pag-document. Yan yung process mapping. Plus, tingnan nyo yung mga shapes na ginagamit, rectangle lahat. Because the rectangle indicates processes. Okay? The rectangle class would indicate processes for that matter. But look at the workflow design. Sa workflow design class, different types of shape yung ginagamit. And in particular, you have your rounded rectangle. Okay? Plus the first one here, the first shape here is your rounded rectangle. Okay? Kindly take note of that. Then you have your diamond. Then class, you have your rectangles. Ano pong ibig sabihin ng mga shapes na yan? Class, the rounded rectangle is actually intended to signal the start or the end of the process. Okay? It's intended to signal the start and the end of the process. the diamond class is actually a decision box. Your diamond there is actually a decision box. Now, try to look at an example of a diamond. Okay? Class ito, diamond. History of BMI greater than 25. Pag yes, dito ka pupunta. Pag no, dito ka pupunta. Okay? So class, it's a decision point, no? If what you will be doing next. And then the other one, the rectangle, as I mentioned earlier in the process flow, your rectangle is actually part of the processes. Okay, your rectangle class is actually part of the processes. Okay? So class, yan po yung pinagkaiba ng tinatawag nating process flow at saka ng workflow design. So pag titingnan natin, sino po yung mas complex? Sino po yung mas detailed? Is it the process flow or the workplace or the workflow design? Sige nga, sino po yung mas mamakukonsider nating mas complex? Is it your process flow or is it your workflow design? Anybody? Even on the chat, what's considered to be more complex? Is it the process flow or is it the workflow design? Sige na, I'm waiting. Okay, so yes, no. Okay, yes, it's the workflow design that is considered to be, okay, your workflow design is considered to be more complex compared to that of the process flow. Okay, now, what are naman the informatics competencies for nurse educators? As I have been mentioning, nurse educators are also required to be knowledgeable and to be skillful in nursing informatics. Okay? Hindi po pwede in our end as nurse educators to think that we do not know about the technology. Why? The thing that you will be using kasi by the time that you will graduate in the hospital are already applications of this technology. And as nurse educators, we need to be able to have knowledge on this so that we will be able to teach you also if what are the appropriate technologies that are being practiced in the hospital. Okay? Dapat alam namin yan bilang educators ninyo. Now, what's the problem on nursing education and technology also, no? Or informatics competencies? We all know that nursing informatics is already part of your curriculum. Okay? Nursing informatics has been part of our curriculum since 2009. However, studies would show that many nurse educators lack competencies in informatics. Okay? Marami pong educator ang hindi pa po marunong ng tinatawag na nursing informatics. And then other than that, there is a lack of requirement for PhD programs to include nursing informatics. What do we mean by that? So class, after your BSN, another thing that you can do is you can study for your master's. So you have your Master of Arts and you have your Masters of Science. Okay? So class, Master of Arts if you will be inclined in the academe, Master of Science if you will be inclined in practice. And then after that class, you have your PhD. The next step to the MAN is PhD. The next step to the MSN is Doctor of Nursing Practice. Okay? Now class, in our PhD programs, hindi po naman kami required to learn nursing informatics. And the point of your reference text is that supposedly in the PhD program, there should be an inclusion of nursing informatics so that nurse educators would be more expert in the field of informatics. Pero mind you, it is not included, okay, in our PhD programs. And if it is included, haphazard lang po siya. Ibig sabihin parang it's just a little topic that we need to discuss. Okay, we are not learning advanced skills in informatics. Usually, we are learning the advanced skills in informatics by attending seminars, no? And abroad, there are training programs that would do it. Okay, so those are some of the challenges. And then, there is a need for methods required for big data research. So supposedly, pag marunong kaming lahat ng nursing informatics, we can easily collect large volume of data that would be able to possibly guide the research of our students. Okay? So these are some of the challenges that we are encountering in the academic setting. So nagtuturo po kami ng nursing informatics pero hindi pa po lahat sa amin ay already experts in the nursing informatics field. Okay? Now, what are the informatics role? No? Ano po yung role ng nurses, ng isang informatics nurse dito sa Pilipinas? So 1+ is to ensure Okay, one is to ensure proper recording or documentation with the use of technology. Then, utilize information and technology in health education. Kindly highlight health education. Then, it should be collaborating with other healthcare professionals with the use of hospital information technology and educational IS or information technology or system. Then you have your use of simulation learning and also class to educate students about nursing informatics and facilitate use using ICT. Your ICT class is Information Communication Technology. Okay? Yan po ay isa sa mga ilan sa mga pwede nating gawin as informatics nurses here in the Philippines. Now, how about if there is an INS na? So, class Informatics Nurse Specialist. Kapag may Informatics Nurse Specialist na po tayo, pag titingnan po natin, the Informatics Nurse Specialist would be the one inclined on research and theory development. Other than that, they are the ones who are supposed to design information systems that would work well here in the Philippines. Also to test human-computer interfaces, contribute to health information policy, champion or advocate for nursing informatics in the country, and help develop standardized nursing terminology in the Philippines. Okay? Now, if you would look at the left side of the slide, I underlined their roles in the Philippines. Would be. Bakit po would be? The informatics nurse specialist is very minimal here in the Philippine setting. Okay? Kakaunti lang po yung nurse informatics specialist dito in the Philippine setting. And for us to be considered a nurse informatics specialist, usually they are undergoing training abroad. Okay? I have met some people, class, and what they are doing is that, for example, I've met a person who is based in a university. Sa university siya nagtatrabaho. He is also a nurse. He is an informaticist. He is engaged with Apple. He is considered to be an Apple certified professional. What he is doing right now is to develop technology, okay, to improve the simulation in the country. Okay, he is developing technology to improve the delivery of simulation in the country. And at the same time, he is also studying abroad for his advanced degrees. Na. So may mga ganon, pero limited pa sila sa country natin. And hopefully, by the time that you will graduate, you will be among these people who will be considered to be informatics nurse specialists. Okay? Now, let's talk about the standards of informatics practice among nurses. And these standards is actually based in your American Nurses Association by 2015. Okay? Now, class, tingnan natin yung standards. There are 20 standards on this one. And I would want you to go over the definition of each of these standards. And let us try to connect it to the nursing process that we already know. Okay? Now, class, tingnan yung standard number 1. If you would look at standard number 1, it talks about assessment. And if you would look at the first step of our nursing process, it's also assessment. So, class, as an informatics nurse, we should be able to collect data, information, and evidence pertinent to the situation. So, class, assessment siya kasi. Kaya pag sinabing assessment, collect data. That's the keyword that you need to remember. On the next standard, okay, this is still continuation of assessment. So, class, in your assessment, there are different algorithms that could be used. And one of these algorithms is your PIECES. Okay, your PIECES. Your P class stands for performance. Okay, then class, your I stands for information. Your E would stand for economics. Your C would stand for control. E for efficiency. And then S for service. Okay, so you have performance, information, economics, control, efficiency, and service. Ano pong ibig sabihin yan? If you are assessing a technology, we can look into its performance. Okay, okay ba yung throughput niya? Okay ba yung response time niya? How about the information? Can it have output, input, and stored data? So plus, this is the criteria that we use in order to assess the technology. Okay? Now, standard 2, diagnosis, problem, and issue identification. Just like your nursing process, after assessment, you will have diagnosis. And it will use the assessment data to identify the diagnosis, problems, issues, and opportunities for improvement. Ano naman ang key message dito, class? Na yung ginagamit talaga natin is the assessment data for us to know kung ano yung problema ng ating system or information technological system. Standard 3, outcomes identification. And when I talk about outcomes identification, this is the time that you identify the expected outcomes to plan individualized to the healthcare consumer or the situation. Okay? So as what we always repeat, the plan should be individualized to our respective patients. Standard 4, planning. Okay? Planning. This is to develop a plan that prescribes strategies, alternatives, and recommendations to attain the expected outcome. Balik sa nursing process, di ba? Assessment, diagnosis, outcome evaluation, tsaka planning. Pag titingnan po natin yung outcomes actually, outcomes is sometimes considered part of the planning. But in this case, it was separated para na mas ma-delineate ang function nila. Standard 5, implementation. In the implementation class, it is where you coordinate the activities, you do the health teaching and the health promotion, and it is when also you do your consultation. On standard 6, it's already your evaluation. In other words, class, we evaluate the progress towards the attainment of your outcomes. And in standard 7, you identify the informatics nurse practices ethically. Okay, we're talking here about ethics na. And it should combine with the use of the code of ethics for nurses. Okay? Di ba paulit-ulit na sinasabi ko na whatever you're doing with the technology, think of ethics. Privacy, confidentiality, beneficence, non-maleficence, justice, all of those ethical principles. Then education. Class, as an IN, informatics nurse, we need to address the need to attain knowledge and competency, including competency association with the demonstration of commitment to lifelong learning. Kindly highlight the words lifelong learning. Okay? So class, ano pong ibig sabihin ng standard 8? We are encouraged to continuously learn. Okay? Hindi po ibig sabihin na feeling natin expert na tayo, we stop learning. So we continuously learn. In standard 9, evidence-based practice and research. So this confirms that the informatics nurse integrates evidence and research findings into practice. Okay? Di ba sinasabi natin na we don't do things because our grandmother told us so. We don't do things because older nurses do it like that. But we do things already because of evidence. Okay? We do things because of evidence. And that is your evidence-based practice and research. Then you have also your quality of practice for standard 10. So plus your standard 10 describes the expectation for the informatics nurse, okay, contribution related to quality and effectiveness of both informatics and nursing practice. So here the emphasis is quality, effectiveness of both nursing and informatics practice. Those are the important words that you need to capture. Then for standard 11, communication. We need to be able to communicate effectively through different formats. Ibig sabihin, written man siya, spoken man siya, with several competencies that would delineate the specific requisite knowledge, skills, and ability for demonstrated success. On standard 12, leadership, ibig sabihin we lead in the professional practice setting as well as the profession. At it would include class mentoring, ibig sabihin, nagtuturo na po tayo, problem solving, and promoting the vision, goals, and strategic plan of the organization. In standard 13, collaboration, that would mean class that the nurse would need to have collaborative effort with the healthcare consumers, families, and others in the conduct of nursing and informatics practice. In standard 14, professional practice evaluation, that would mean that the IN should be able to conduct evaluation of their own nursing practice and guidelines, relevant statutes, rules, and regulations. So dapat tayong mga nurses aware din sa practice na gagawin natin. Standard 15, resource utilization. Ano naman po yung sa resource utilization? This would address the informatics nurse use of appropriate resources. Okay? Di ba palagi kong sinasabi, the resources in the hospital are only limited. It's not unlimited. That's why we need to be able to have safe, effective, and fiscally. Plus pag sinabi kong fiscally, isipin nyo na lang muna financially, okay, responsible informatics and associated services. So plus that would mean that hindi porket mahal siya, yan yung bibilhin natin. Okay? We need to evaluate the capacity, the capability of our hospital before we decide to procure, okay, something expensive. Then, next, you have your standard 16, which is environmental health. Oh, come on, isipin nyo. Sir, informatics, technology, tapos nurses kami. Saan papasok yung environmental health? Plus, the purpose of your environmental health here is to remind us that as nurses, we have a responsibility to take care also of your environment. Okay? May responsibility tayo na dapat ingatan natin yung environment. Okay? Now, again, there are only 16 standards pala. No? I think I mentioned 20 earlier. So kindly correct that. There are actually 16 standards. Now, for these 16 standards, these are not something that you need to memorize, okay? But something that you need to familiarize to remind you that if you will be practicing informatics nursing later on, there are a set of standards that needs to be followed. Okay? And this standard is actually prescribed by American Nurses Association. There is no Philippine counterpart yet. Okay? Wala pang Philippine counterpart. Pero baka by the time that you are practicing, there is already a Philippine counterpart that you need to study. Okay? So again, these standards are guides. Okay, these are guides for you to practice effectively as an informatics nurse.